All right, welcome back, everybody. We are back here again live, and I'm here once again. I'm Brett Norton, and here once again with Lindsay Brown. Linz, this has been quite the day so far. We've had some great presenters, some great content, really good engagement from our attendee base, and looking forward again to another great presentation.
Absolutely. It's been an incredible morning. There's no place I'd rather be on a beautiful Friday. It's still morning here in Minneapolis, so beautiful Friday morning.
Yep. Well, happy Friday, everybody. I'd just like to take a moment real quick to thank our premier event sponsor of the day, 3M. And as a reminder, in the upper right-hand corner of your screen, you'll find many links and downloadable documents that have been provided for you. So please feel free to jump in and check those out when you have some time in between sessions. So we'll get to it. The team at Vested Medical, I have had the pleasure with working with them on a project in the past, and so I have the honor of introducing both Paul and Jody. Paul Borland is the Vice President of Operations at Vested Medical. He is an experienced and innovative leader with over 20 years of experience developing inventory and logistics solutions. His expertise includes medical devices, inventory management systems, product management, and vendor relations. Paul's focus to reduce waste and associated costs while improving customer experience has established himself as a respected industry team leader. Jody Eisenberg is the Vice President and Chief Quality Officer at Vested Medical. She has over 30 years of experience in healthcare quality accreditation and clinical compliance. Jody is responsible for the development and facilitation of the quality management system for offsite sterile processing for Vested Medical. She is dedicated to improving quality, patient safety, and the overall patient experience. The safe transportation of soiled instruments within a hospital or healthcare facility is critical to employee and instrument safety. Paul and Jody will explore the current requirements for soiled instrument transportation and the impact on safety and infection control. They will also outline the parameters for implementing a consistent and reliable transportation method that will ensure instrument quality, instrument sterility preservation, and protection from contamination of dirty instruments during transport. Just real quick, want to remind everybody this is an audio-only presentation, so just in case you don't see any video, that's the reason behind that. But without further ado, let's welcome Paul and Jody.
Brett, thank you so much. Paul and I are so grateful to be a part of this conference. We've had a wonderful experience with Beyond Clean and appreciate all you do for the industry. Brett did take some time to go over the learning objectives. They're here in your presentation for your reference. In order for us to really get to know who's out there in the audience, we'd like to start with a polling question. And so I'm pushing the polling questions out to you. Basically, we want to know whether or not you've considered transporting clean, sterile, or soiled instruments. And we also would like to know if you're currently transporting those and how you're transporting those. And while you're entering your answers, just a few comments about our topic. One of the things that we have focused on here at Vested Medical is an effort to build a more cost-effective delivery system in the area of SPD. More and more organizations are moving care out of the acute setting and into the ambulatory setting. And as we see this shift, for surgeries in particular, we also see some significant challenges. And those challenges relate to logistics, storage, and resources. And sterile processing, we know, is an essential function within perioperative services. And what we've seen is that ambulatory settings in particular are often challenged They're challenged with space constraints, inadequate facility conditions, capital limitations, and staffing. Sometimes that staffing isn't able to support consistent sterile processing guidelines. And we've seen this gap show up in accreditation surveys. And most importantly, it has the potential to contribute to significant patient safety issues. So we want to tackle some considerations for you to think about if you are considering transporting your clean, sterile, or soiled instrument trays. So let's take a look at the results of the first question. So have you considered transport? Wow, this is really interesting. Paul, what do you think about the comments?
I think it's a higher number than I was expecting.
I absolutely as well. So we've got 63% saying, of course you've considered it. 21% say no way. I would be really interested to know why the no way. And after we go through our presentation, hopefully you'll learn some key considerations that might allow you to think outside the box. And then we've got about 15% that are really kind of on the fence, like I'm thinking about it, but not quite sure. So let's go to our second question. Are you currently transporting clean, sterile, or soiled instruments outside your facility? Take a few minutes to answer that. And we know out in the industry, we've seen published, there's a few large healthcare systems that have built their own centralized sterile facility, and they're transporting within their system. So we know it's happening. Paul, any comments?
There's been some pretty large health systems this year, right, that have opened the doors on some facilities they built, and really exciting to see the shift in focus to efficiency and quality and standardization. I think it's a great move.
Absolutely. So let's go to the answers. Wow, 61% are transporting. That's really cool. Some of you are using a courier service, and we're going to talk a little bit about that. If you are using a courier service, some of the things that you need to think about relative to safety and quality. And then we've got 19% that said no way.
Yeah.
Think we can sway them?
Well, we're going to try.
All right. So let's just set the stage. We're going to talk a little bit about what the current state is now. And we know, you know, our audience knows that sterile processing is critical to the care of the surgical patient. There are organizations out there, as I referenced just a minute ago, that have multiple sites, and they might have multiple places where they do sterilization. In my mind, this creates potential increases in errors, deviations, and it can also increase the risk of infection for the patient. The more areas you have sterilizing, the less consistency you potentially have, which could lead to those errors. In all sterile processing departments, we've got labor-intensive quality control requirements, and it's imperative that we follow those to the T. Right now, current SPDs are responsible not only for the inventory that they own, but also for inventory that comes to them via vendor representatives, those loaner sets. And I know the loaner sets are everyone's favorite friend. Reliance on vendor representatives to deliver loaner trays in time for processing prior surgery continues to be a challenge for many of our organizations. Paul, do you want to talk about what's pushing organizations to transport?
Yeah, I think one of the first things that we're seeing when we're out in the market is this idea to really utilize our assets, right? So instrumentation, maybe for a cardiovascular day, is in rotation today, but it wouldn't be in rotation tomorrow and could be moved to another facility that is having a cardiovascular day, right? The same with the loaner instruments, really trying to pool those resources and optimize how well they're being used across the health system. We're also seeing, it's a high capital game, right, to invest in SPD infrastructure. Washers, sonics, things like that they're not inexpensive. And so as we see the aging infrastructure across the health system, many health systems are looking for a way to, again, consolidate that expense into one single facility as part of their revitalization of SPDs. And then ability to standardize process, Jody, you touched on a little bit. If we have one central location, we can streamline SOPs and work instructions and really deliver that consistency and quality across the entire healthcare system when it's under one roof. And then, lastly, facility constraints, infrastructure constraints. A lot of SPDs are boxed in and just frankly don't have the room to move and expand, right? And then when you look at your ambulatory surgery settings, many of them just don't have the footprint either. And something that seems to be really prevalent this year as we've been looking at technicians is a qualified pool of experienced technicians. It seems to be a shortage out there in the industry of certified techs that are able to jump in and kind of meet the speed and pace of an SPD department.
Yeah, so Paul, you've actually touched on some of those current state challenges. And, I think in a large organization, one of the biggest challenges is the fact that SPD is not a revenue-generating department.
Right.
It is, you mentioned the aging infrastructure. I think leaders are faced with challenges on where to invest the limited capital that they have. And if things are working okay, they're not going to invest. And many times I think that leadership doesn't necessarily realize the constraints that are going on within that SPD. Talked a little bit already about the move of procedures to ambulatory settings. That in and of itself creates its own challenges. You talked about the ambulatory settings not being set up to adequately process. We've seen ambulatory settings that have one sink, right, and they are processing complex orthopedic procedures. And so there are quite a few current state challenges that are pushing organizations to think about that transport process. Yes. How do we make sure that we're doing it right? You talked about the staff deficit. There's also a deficit or a potential challenge to those staff that are in SPD to maintain the knowledge and competence related to processing those complex loaner sets that arrive in sometimes less than 24 hours till the surgery. That puts a real strain on capacity and staffing. We're relying on a vendor rep to go from one city to the next city to bring that tray to us, and that really strains staffing, strains capacity, and puts pressure on the leadership of SPD. What are some of the challenges of transporting that you see, Paul?
Well, one of them you just touched on, asset planning and demand planning, right? Trying to plan what resources are going to be needed for the next day when there's often a communication barrier or breakdown, right? So I'd say that's probably the second one is communication between vendors, communication between surgeons, and even aging and inadequate preference cards, right, that are not meeting the current demand in your operating rooms. I also think, when you look at core competency, hospitals are not known logistics and demand planners, right? They don't plan routes and inventory utilization and forecasting. And when you think about moving to an offsite model, those become very critical to the success of your offsite facility.
Absolutely.
And then, asset management and visibility as things go out on the road and start moving from hospital A to B to C. There's a lot of room for error and mishandling of trays and not getting to their destination, right? So that visibility to where assets are in the field and how to call upon them if maybe there's an add-on or a surgery change, right? Those are some big challenges on the logistics side.
Yeah, absolutely. So let's start talking about the current guidelines that are out there for transportation. And I will just say that there are many organizations out there that are weighing in on sterilization practices. Currently, though, when we look at transportation, there are really only 3 primary organizations that speak to the transport of sterile and contaminated packages. And I've got those on the screen. It's a bit of a busy slide, but I have these as well noted in the references. And I'm sure that those of you on the program today are very familiar with the guidelines that are out there from AAMI, AORN, and OSHA. These 3 organizations, they primarily focus their attention on transporting within the 4 walls of the healthcare facility. And AAMI does include a statement on transport vehicles. For the most part, these guidelines are referring to the transport of sterile and contaminated packages within an organization or between buildings, not necessarily between healthcare facilities. So one of the things that I would say would be a key consideration for all of you if you're thinking about transporting outside of the facility, that vehicle has to be thought of as the hallway. It's an extension of your hallway outside of the OR. Now, AAMI does have a work group underway developing a technical information report. I sit on that work group, and there are some incredible experts on that team. That guidance will come out, and it will have guidance and references for the transport of clean, sterile, and contaminated packages outside of a healthcare organization. Some of the key guidelines that we see in all 3 of these references that are available today is they absolutely say that you should separate clean and sterile from contaminated. And they also absolutely say that you should transport in a leak-proof, puncture-resistant, and labeled container. Keep in mind that off-site sterilization and transport between facilities is a common practice in Europe. So while we may think that it's prohibitive in our situation, or we would not want to transport sterile, you know what, it's being done every day. Some of the key questions to think about as you consider off-site sterilization or transport between facilities. I've got a question on the page here. So if you are transporting, let's see who's in charge. Oops. Sorry, we didn't set that up as a polling question. We're interested in knowing and want you to think about where your instruments are being sterilized. So are there procedures for sterilization comparable from site to site? So as Paul and I talked earlier about the more sterilization areas that you have, the more important it is to standardize your operating procedures and make sure that they're comparable, that the expectations you have at one site meet the expectations at another site. So, for example, are the orthopedic instruments sterilized at your ambulatory surgical center following the same standard procedures as your main hospital? Many ambulatory surgery centers aren't set up for that volume and complexity. They're being pushed from the acute care to the ambulatory setting. Organizations need to be sure they're accommodating for that. So the risk is inefficient, ineffective cleaning, disinfection, and sterilization practices. And that can ultimately lead to patient infections, patient safety issues. So when you're making the decisions to transport, consider who is transporting your instruments. An Uber driver really isn't qualified. And while a courier might be able to transport, can they do it safely and effectively? Do they understand what they are transporting and what the risks might be? So we've added the questions in here. I'd like to know, where are your instruments being sterilized? Take a few minutes to answer the question. And then once we have your answers, we are going to talk about some key considerations to ensuring your transport process is safe, is effective and efficient, and above all, protects your staff and ultimately patients. All right, so Most of our sterilization is occurring in the hospital SPD, and that would have been my guess. Yours too, Paul?
Yeah, definitely.
Yeah. And a few, we've got sterilization occurring in the ASC. All right. So as I said, today we're going to take some time to go through the 6 areas of focus that we've determined need to be taken into consideration in order to create an optimal mode of transportation, not only for contaminated, but also for clean and sterile product. We're going to talk about those key considerations and talk about the transport process, and most importantly, when we're talking about these key considerations, our goal is to provide a mechanism or a method for transport that is overall going to be protective of your staff, but ultimately the patient. Paul, do you want to tell us a little bit about your key considerations in the realm of safety?
Sure. Safety is obviously key for staff and for the delivery of the product and ultimately the patient care. And when we think about safety and transportation, the back of a car or a van, a local van, doesn't really meet the requirements that exist today, or even potentially the future requirements when the AAMI standard comes out, right? When we think about safety, you look at the cargo area of a van, and there really should be separation, maintaining a barrier of protection. AAMI outlines it currently that there should be some sort of barrier between your sterile packaged and your soiled goods when transporting between facilities. So the generic van doesn't necessarily have those cargo separations, right? We also look at our DOT and OSHA standards that currently exist, and many local state agencies, they say you have a requirement to protect personnel from risk of injury or exposure, right? And it's very important to pay attention to that when you're writing your SOPs or work instructions for off-site transportation, really making sure that you've buttoned up that safety requirement for the personnel driving. Something that's often not thought about when these vehicles are moving from hospital to hospital is vehicles really shouldn't be left unattended either, right? There's a potential risk and exposure that somebody accidentally gets into a vehicle that has material that has bloodborne pathogen on it, right? And you really need to consider how you're going to show up at your facility, keep the vehicle attended or locked at all times, and really make sure that you mitigate any sort of risk to an unsuspecting bystander.
Excellent. Now we're going to talk about environmental controls and monitoring, and I just want to preface this by saying that there are no solid requirements for environmental controls and monitoring in a transport vehicle. This is really a subjective and gray area, and many people across the industry have taken different stances on this. There are a lot of questions that come to mind. What monitoring is required in the transport vehicle? Is monitoring even required or realistic in the transport vehicle? How do we know if sterility assurance is maintained if those temperature or humidity measures go out of range? And if the temperature goes out of range and you're transporting sterile product, is that considered an event that would impact sterility? Keep in mind that there aren't even any studies out there representing extremes on either end to prove that sterility is maintained or not. So the best information we have is from ASHRAE, and you'll see it on this slide, and I've also included a reference for you to reach out to, and my guess is you're all familiar with this. These requirements are defined for the facility. So, in lieu of no solid standards, the best we can do is start by trying to mimic the requirements of the facility. I'm not sure how realistic that is to maintain those temperature and humidity requirements, but you should really think about how you can do it appropriately, how you can measure and monitor it, so that you can create, as we talked about before, that extension of your hallway. So one of the things at Vested Medical, we've also looked to the pharmacy industry. They've got experience in transporting temperature-sensitive product. USP 659, which covers packaging and storage requirements, gives a variety of different examples of storage conditions, and they specifically address controlled room temperature and the probability of excursions or deviations outside the normal range. In the pharmaceutical industry, they recognize that those excursions are a given. You're going to have excursions in temperature, especially in, not only pharmacies and hospitals, but warehouses and during shipping. And so what they say is these excursions are allowed as long as the mean kinetic temperature does not exceed 77 degrees Fahrenheit. So taking all that into consideration, you really need to do a risk assessment to see, what are you transporting and what would the impact be if those temperature and humidity would have, would go out of range. Again, our kind of fallback, if you will, is every time we handle that package, every time we pick up that package, we're looking to see if there has been any damage to the integrity of the package. When we open the package, we're looking for signs that would tell us that the instrument tray sterility has been breached. So we do have that fallback. But in lieu of that, we really want to think about the environmental conditions. So some of the other environmental conditions and monitoring considerations that you should think about would be time in transit. How long will your instruments, dirty or clean, be in transit? What's the distance that you are traveling? What's the climate that you're traveling in? So think Arizona in the summer, Minnesota in the winter, different considerations based on where you're at in the United States. These are really important when you're thinking about how to do it safely, effectively, and efficiently. Paul, do you want to talk a little bit about infection prevention and control within the van, within the vehicle?
Certainly, I'd be happy to. So when we look at infection prevention and control within a vehicle or fleet service, the first thing that we look at is OSHA. They've got some standards on bloodborne pathogen that really set the bar on how we should handle the environment of a vehicle that's transporting sterile and soiled. And particularly Section 1910.1030, Section D4. They talk about employers shall ensure that a work site is maintained clean and in a sanitary condition, and an appropriate written scheduled cleaning method needs to be established, right? So we think about the frequency in which the vehicle needs to be cleaned. That needs to be a well-established process as an OSHA guideline. All equipment and environmental working surfaces should be cleaned and decontaminated after contact with blood or any other infectious waste. Again, that's an OSHA standard, right? So that should be written into our work instructions. We also look at the Department of Transportation sets rules forth, and many state and local agencies set additional rules. So as we think about the audience here on the phone, or on the call, really should look across their local governing bodies as well to see what might be a municipal, county, or state regulatory standard for the vehicle. When considering how you prepare your vehicle, though, to meet these standards, you really should consider, setting up that multi-zone as we established and is required through AAMI to separate soiled and clean from each other and sterile. We recommend that, you look at a non-porous anti-slip material to line the vehicle, something that, protects the staff when they're entering and exiting the vehicle, but is also something that wouldn't absorb microorganisms and is easy to clean. On a daily basis or whenever there's a spill, you should really be able to wipe down and sanitize effectively that environment. Something else to consider is your shelving. If you're using shelving for the trays, again, a non-porous surface that allows easy cleanup. We found that anti-slip mats are great to hold trays in place and really help protect the integrity of the sterile goods. But those mats also need to be able to be removed and cleaned properly so that there's no microbes growing unknowingly. And then lastly, we think about safety for the driver as well as just avoiding any sort of distractions. And the cab really should be cleaned and maintained as a safe, clean environment. Your driver or whoever is handling your transportation should, practice proper hygiene, cleaning their hands, and when handling the goods, wearing PPE if they're handling soiled material. These are all very important standards to have in place in protecting both your teams, your transportation teams, and ultimately patients.
One of the things that came to mind as you were talking is, when using a courier, you think about bloodborne pathogens. Is one of the considerations to make sure that courier gets some sort of training in bloodborne pathogens?
It really is. I mean, when we look at working with third-party couriers, bloodborne pathogens is part of one of the standards that we require any courier to have, and showing competency in that, as well as PPE, right? How to don and doff
Right.
PPE is very important in protecting those drivers.
Great.
Something else, the next section here that we wanted to discuss was, the stability and protection of package integrity. And I would ask the audience to think a little bit about just today's sterile processing environment. We've got our rigid trays and our blue wraps, and they ride up and down the elevator a few times and get handled. And there's a significant probability of risk of an adverse event, something being punctured or torn and not being able to be used. Now let's throw transportation into that mix, right? More touch points, more hands, more transport carts, distance and the vehicle itself, right? It makes you really stop and think and consider, what are you going to use as your transportation method? Is it blue wrap? Is it rigid? How are you going to protect it? And I would ask the audience to just think of I'll give you two examples. On the med surg side, implants, right? Implants come in, they have a cellophane wrapper on the outside, and then a box, and then a peel pack, and then another peel pack, right? And then the implant, right? The med device companies have done a phenomenal job because it's an FDA requirement to build a very complex but protective transportation matrix for their goods, right? And then when you look across to med surg, your gowns and drapes and disposables, it's very similar, right? Our product shows up in a box as the outer protective barrier, and then there's typically a bag, and then there's the product that's going to be consumed, but that's in a 6 mil thick protective barrier, and then there's a drape, right? And so there's all of these layers that have been established to ensure integrity and sterility. And I ask this audience to consider that when you're looking at your transportation. It's very important that you build a model that provides those additional barriers and protection so that when the goods are opened in the operating room, you can rest assured and sleep peacefully at night that those goods have not been compromised. And equally on the reverse, when we send the product back, we really need to protect all those that handle it. And now that you've added distance in, all the additional points that bloodborne pathogen or bioburden, exposure could increase, right? So we need to really consider our transportation medium. And something interesting I thought of, I reflected back on my years as an SPD manager many moons ago, and we used to transport to our ambulatory surgery setting with a dust cover, right, that we would buy from one of our local vendors. And it didn't dawn on me at the time, but now as we look at our transportation model here at Vested, we were using product that was less than 3 mil thick to protect our material, and really wasn't adequate at the time. If you look at what Cardinal, McKesson, or any of the med surg companies are providing, their minimum is at least 3 mil thick. And we've done, Jody, some great studies on what a 6 mil polyethylene bag can do in terms of protection, right? So, I ask this audience to really consider, their choice when they're preparing their vehicles and their trays and for transportation off-site.
Thanks, Paul. So now Paul and I are going to take some time to talk about some additional delivery and retrieval considerations that we've taken into consideration here at Vested. And Paul, since you're over operations, I'm going to let you talk about driver competency and the considerations you should think about when handing off that product to a specific driver.
Yeah, well, again, goes to an earlier comment, Jody, about that I made about the core competency of a hospital, right? Fleet service and management and driving isn't really in the healthcare profile, right? And so when you think about employing a driver to go out and move product for yourself or even a courier, safe driving is key. We live across many different states with many different environments, and trying to ensure that a driver is well trained to handle hazardous conditions like rain, snow, is very important in that driver competency. We've also found that evasive driving maneuvers and training are very important as well. You get out here on these highways and making sure that you can navigate safely around some people that may drive less than safely is really important for your driver's safety. One of the other things, you touched on environmental monitoring and controls. How much does the driver need to understand how to manage that as well, right? To ensure that where you're keeping your sterile goods are being maintained and holding those standards that you've set for your facility. It would be important to educate them how to maintain and control that, or how to even inform and potentially have a quality hold because the product went outside of those safe ranges, right? And then lastly, we've touched on it a few times, competency around bloodborne pathogen spills handling and PPE is very important as well for these drivers.
Great. Another key consideration is accessible supplies within the van, and honestly, hand hygiene supplies, a spill kit that's appropriate and can accommodate the type of product that you're transporting, some basic cleaning supplies. Paul talked about this, having appropriate PPE on board. And, if you're using dust covers to protect your containers, you may want to have additional dust covers. Another key item would be a first aid kit. Perhaps you'd also want to have your, anything that you might need for the vehicle itself, should there be a problem with the vehicle. Again, think about all of those things that could occur. I would recommend doing a risk assessment to identify any additional supplies that you might need. Paul, you want to talk about loading and unloading. This is pretty key. Those trays can get really heavy. There are a lot of trays. So what are some of the considerations there?
Yes, it's a great point, Jody. I mean, that's probably one of the riskiest areas, right, is in now the movement of the product, both to the product but also to the team members involved. When we think about safe loading and unloading, you've now introduced likely a step up or a step down by putting a vehicle in place, right? So a team member needs to practice proper body mechanics when stepping in and out of the vehicle, and also when they're carrying something that weighs 25 pounds now in their hands. It's added a new dynamic to that. So just making sure that staff are trained properly and you've got the right processes in place to ensure that they can enter and exit the vehicle without injuring themselves or even compromising the integrity of the product is key. Transportation carts become very important in this model. Sterile or case carts seem like a very obvious solution. They do meet many of the requirements for moving the product to and from. But there's some other options out there, and I would just ask the audience to consider, if you look at other types of transport carts, whether they're wire carts or solid shelf but not enclosed, or even dollies, these can all meet the requirements, but you just have to make sure you do that risk assessment to make sure that there's no cross-contamination possible, that sterility isn't compromised, and that the carts are actually adequate for moving the weight and the load to and from the vehicle into the sterile processing department. Something else that I think is really important to consider is your labeling, proper labeling of the trays in transport, not only just to know what the product is and what cases in surgery and hospital that it's going to, or ASC, but also clearly identifying visually soiled versus sterile, so that there's never a risk of cross-contamination or exposure, is really important in designing your transportation protocol.
Great. And you had alluded to this earlier on about tracking and tracing, but there is tracking and tracing the continual life cycle of instruments is not only important to the manufacturer, but important to the facility as well. If you're considering transporting trays or contracting out this particular process, tracking becomes integral not only to the logistics piece, but to the patient safety equation. Because once we add in that next element, we're going to hand off to somebody else. We're going to hand off to the courier who's going to hand off to the next facility. That creates more opportunity for human error. It also creates difficulty in accurately accounting for the surgical tools before, during, and after a procedure. You want to make sure that you have sight into where your instrument tray is at all times. That also helps to think about the schedule of that instrument tray, if you will. So, we're not just thinking about the next place it needs to be, but how quickly can it be turned and then delivered to the next surgery where it's needed. Accurate medical device tracking is not only important to patient safety, but it does also play a big role in accreditation and compliance as well, on both the manufacturing side as well as the provider side. The items that you're transporting should be checked before and after the procedure to ensure that everything necessary is already in the operating room before the procedure starts, and then also is accounted for after the procedure has occurred. Paul?
Jody, I would just recommend maybe the team here on the call also look into the FDA requirements for off-site sterilization services.
Yes.
Although they don't govern the hospital facility, they are a really good set of rules on how to properly track and trace and follow good standards and practices for labeling and tagging your assets.
Absolutely. Having that line of sight from point A all the way through point Z is really critical. It's also going to teach you a lot about where you might be able to optimize and how best to utilize those instrument trays. So great point. So we're going to end here thinking about the future of healthcare and innovation in healthcare continues to push us to think about how to do things better, how to do things faster, more efficiently, more effectively, hopefully safer for the patients. I think over the past year, COVID-19 has further taught many of us to think outside the box. In healthcare, we've had to adapt quickly to daily changes and challenges over the past year. And, largely it's been challenging, but we've had some great successes too. So relative to creating a transportation solution for the life cycle of an instrument tray, I challenge everyone on the call to think outside the box. Just because we've always done it one way doesn't mean we can't try to do it differently. We can't try to do it better. The one thing that I would say is keep it simple and keep it safe. I'd also like to point you to the references that we've had available in building our transportation solution. And I'd point you to all of those that are referenced in the reference section, as well as any that we've mentioned here. And I'd like to point out on our Vested Medical site, we did create a white paper that outlines some of these key considerations that Paul and I have covered today. So thanks so much for listening to us, and we'll turn it back to Lindsay and Brett to do questions and answers.
All right. Paul and Jody. That was great. I know that, I've had some experience with transport here in Denver with some manufacturers actually transporting implants back from hospitals, and there have been some questionable procedural tactics when that goes on. So great to see your insight on that front, and I'm sure that this is a way of doing things that is going to evolve in the coming years. So really appreciate you joining us. Anything to add, Linz?
Yeah, actually, what's so interesting is from each virtual conference to the next, there seem to be some specific themes that arise. And I think based on the number of questions that we've gotten on sterile and clean and dirty transport, we could do an entire conference just based on this topic. And so something maybe that we in the Vested team need to explore for a later date. But this is such a timely conversation, and I'm really excited to get into the questions.
Yep. Yeah, we've got a couple of a few good questions here. So we've got some time, which will be great. First one here is, how does the transport requirements apply to how we currently receive loaners? Almost all the time, loaners are transported unsterile and in the back of someone's regular vehicle and wheeled down the hallway unprotected.
So that's one of the reasons why we decided to implement our solution here at Vested Medical. It currently doesn't really, there aren't any guidelines out there that talk about transporting that equipment not disinfected, not sterile. We do know, though, that, part of the consideration we talked about was protecting those instruments. I think that's a key consideration. And I also think the logistical tracking. Paul, would you add?
Yeah, well, I think, coming out of the med device world in a past life myself, it really bothered me that the same trunk of my car that had those trays in it also had my groceries. And I think, although, Jody, to your point, there's not a lot of rules in place around that or clarity at this point in time, I do think there's an evolution coming here, right, that really needs to tighten that up and provide that level of safety for all parties involved with those loaner trays.
All right, great. On to the next. So have you noticed information listed in IFUs in regards to transportation requirements?
No, I have not. It's not been something that's been addressed. And Paul, you're much closer to the IFUs. Would you agree?
Yeah, we have not. I can say we did a very in-depth IFU matrix actually a few months back, right, and never saw anything called out particularly to the transportation of reusable instruments.
Right. And what scares me is if that does come to fruition, then you'll have as many different requirements from as many different manufacturers as we have.
Yeah, much like the wash requirements, right?
Yes. So let's not go there.
Or let's get them to standardize. Huh?
Yes,
yeah,
let's
we're going to say
standardize.
Yeah, exactly.
Needs to be more standardized for sure. All right. Next question here. How are the considerations you've described affecting if you are only transferring instruments that have been disinfected prior to transport? Is this still considered biohazardous transport?
No, if the tray's been disinfected, it's not biohazard. And in fact, I would say the considerations that we talked about, some of them would focus in on those that have been disinfected but hadn't been sterilized. So, your handling of those trays, your stability and protection while in the vehicle, Those are some of the things that you want to still pay attention to, even if what you're transporting isn't soiled or sterile. Paul, anything to add?
No, Jody, I think just, once it's achieved thermal disinfection, right, according to OSHA, Department of Transportation, it's met its goal of removing microorganisms. Right. So you're okay.
All right, great. How about what type of decon is done prior to sending off to the sterilizing facility?
Could you repeat that?
Yes. What type of decon is done prior to sending off to the sterilizing facility?
I think it's going to be site specific, right?
Right. So you would need to define that with your contractor. At the very least, you need to follow the requirements to keep the instruments moist, to spray, or you would follow your same procedure that you have in place to transport them to your sterile processing department. That would be the minimum, right?
Yeah, I mean, the enzymatic spray is key. At bare minimum, you want to try to make sure biofilm doesn't start to set in and build up or anything dry, right?
Right.
But we've certainly found that once you've applied the spray, you can encapsulate it in the proper shipping matrix and move it out of the building and have it fully decontaminated offsite.
Yeah, that's a great answer. I think, I'm a big proponent of pre-treatment because Lord, I've been in many facilities where it's not a common practice. So I think adopting that and making sure that that is taken care of up front is really a protective measure for the instruments themselves and ultimately the patient down the road.
Absolutely.
So is there a standard for reprocessing instruments that are not implants between different buildings, but the same healthcare system?
So could you repeat the questions? I believe the answer is no, there's no standard.
Okay. Happy to repeat it. Is there a standard for reprocessing instruments that are not implants between different buildings, but within the same healthcare system?
No, there's this, it's the same, it's the extended hallway and how you get it from, Department A to Department B is currently up to the facility and how they do it. And some facilities are transporting within buildings and they're doing it on their own. I think there needs to be some time to really look at the process to make sure that it's safe, effective, efficient. I would do a risk assessment to identify any potential gaps or areas where that might need to be tightened up or standardized. Paul?
I would just add that I would ensure both facilities are following the same work instructions, right? So that you are delivering that same standard of inspection and disinfection and sterilization in both places, and so that there is no deviation or risk.
Right.
All right,
Think about the exercise that we all went through when, high-level disinfection became a big issue, and we in healthcare organizations identified all the areas where we were doing high-level disinfection, and think about the inconsistencies in the way those procedures were being implemented. Most importantly is to look at your standard operating procedures.
Awesome. Lots of questions. You guys still have some more in you?
Sure.
All right. What are your views managing the physical transport environment inside the vehicle? What do the regulations say?
So I'll start, Paul, and then you can echo. There really are no regulations for inside the transport vehicle. As we talked about, the best we can do is mimic what we know inside a facility. And so I think most important is that cleanability. and that you have a regularly scheduled cleaning. You should have a procedure that outlines routine cleaning, that outlines your response to an event, a spill. That's a key piece. The other piece is that the environmental conditions. How are you going to make sure that inside of that van, that vehicle, is an appropriate environmental condition for what you're transporting?
Yeah, I think, here at Vested, we've adopted best practices, and Jody said this earlier, the vehicles become the hallway, right? So I think for any of the professionals here on this call, just envision that. When you think about your vehicle, it really should just be the elevator, the corridor, the hallway that connects sterile processing to the operating room or whatever department you're servicing. And there really is no reason to treat it any differently. There shouldn't be a less than requirement because now it's in a van. It really should be the same standard that you have inside your facility.
Great. So this next one, Paul, I think we've already touched on this a little bit, but it may deserve a little more emphasis. So how do the instruments stay moist during transport?
Well, yeah, that'll be really kind of written by your protocols. As I said, when thinking and designing your protocol for that transportation box, let's call it, right? If you apply an enzymatic foam or a pre-soak to your instruments, and many of them, if you follow the IFUs, have a significant time period in which they're effective, and then you close that container, let's just say it's a rigid container, so now you've got moist instruments inside a rigid container, and let's, for the sake of argument, say then you place a bag over it for transportation, you've now created this enclosed almost tomb where sunlight and air and things aren't available to dry out that instrument, right? So it really comes down to how you design that shipping matrix. How you're going to move and transport is going to dictate how well those instruments stay moist prior to proper cleaning.
That's where, too, you want to think about that time and distance. When are you picking the instrument trays up? How long are they sitting in, the decontam area of one facility? How long are they in your vehicle? So you want to think about the time and distance as well.
Great. Well, Jody, I think you must have read into the next question because this is in regards to time. Is there a time frame from the end of the case to when they need to arrive and be addressed at the sterilizing facility?
So that's going to depend too. So Paul talked about the protocol, the type of enzymatic cleaner that you're using, or they will most likely tell you how long you have. How long will that be? And you're going to have to strive for less than that. Paul?
Yeah, I would just also point, EME recommends, really that shortest period of time. This isn't something that should sit for any sort of excess time because every minute is increasing the likelihood that it's going to be harder to clean and remove that biofilm.
And this is where, too, the benefit of tracking. I mean, if you've got some sort of a tracking system and you can actually, when that surgery has ended, you can build that into your logistics of transport. Again, that's not something that hospitals or healthcare facilities are set up to do. So it's a challenge, but that would be a benefit of the tracking portion of this.
Right. Yeah. I mean, time can be your friend, but it can also be a real enemy too. So that's important points.
Yeah.
Well, Brandon, when you think about throughput too, right? You really do want to get that stuff through the system just operationally as well, right? So that's just pure process and demand planning there.
Yep, for sure. The logistics are real important when it comes to when the clock starts ticking. All right, so probably have time for one more. And I see the importance of having to standardize transportation of instruments, but with all the new offsite facilities popping up, why hasn't this been on the forefront of concerns?
Well, it's interesting, as Jody touched on earlier, Europe has adopted this for years. It has been very much the standard to consolidate and to really leverage best practices to ensure that high level of quality and that zero defect that's required for patient care. And I think, here I'll just, my own 2 cents in the U.S., we've always just done it this way, right? And it's going to take some out-of-the-box thinking and a little bit of challenging the status quo to elevate the profession and the importance of sterile processing. It is, you guys will probably all laugh because you've heard it before, it's the heart of the hospital. I mean, it is so critical that we're paying attention to this department and what it does.
I also think that we're seeing the move to off-site sterilization, some of the larger facilities. I think one of the concerns or considerations that need to be focused on, we need to make sure that we're not moving suboptimal practices from many organizations into one centralized area and not really thinking about the transports, the logistics, et cetera, that will contribute to further issues down the line. I think we're seeing some of that, in the field with those who have moved to offsite. So I really think that in building this type of system, you need to think about the full continuum from point A to point B and back again.
All right. Well, thank you for sticking with us. Those are some amazing questions, some great feedback. And Paul and Jody, we can't thank you enough for joining us today. It's been an honor to have you on with us. It's really added some great insight. And as Lindsay pointed out, some warrants more discussion down the road. So we'd love to have you guys back.
Great.
Absolutely.
Yeah, we look forward to it.
Based on the number of questions that we didn't get to, it's clearly, another check in the category of we need to do this again. So for everyone who did submit a question that we didn't get to, we will be sure that Jody and Paul get those questions so they can send you an email directly and follow up.
All right. So thanks, guys. Thanks for everybody's engagement and great questions. And we will see you in 15 if you're sticking with us. Grab something to eat, something to drink, and we'll see you soon.
All right.
Thank
Thanks
you
so much.